Hello everybody, this is Dr. Lena coming to you from Sedona, Arizona. I have the beautiful view behind me. It's absolutely gorgeous here. I want to get started with one of my favorite subjects, which is diabetes. I know that I intend to discuss several topics, some of which some of you may not want to hear. You're welcome to tune in. I'll be talking about, at some point, I'll be talking about missions and the things that I do in other parts of the world. I'll talk about medicine and, from the viewpoint of the medicine that I've studied as a physician, as well as my current foray into the wellness space, what that looks like for me as I open up some of the parameters and guidelines that have been given to me to learn about other options that potentially could be helpful for people who are dealing with many types of conditions. And then thirdly, I'll be discussing at some point information about nutrient supplements, skincare opportunities that I am involved with at this point, which I think are going to be absolutely a big deal in the wellness space as well. So those are the three things that I'm usually thinking about on a day-to-day basis. Today's video is going to be more along the medical lines, and it'll be brief. So today's topic is going to be diabetes, and specifically type 2 diabetes. So type 2 diabetes is known as the one that is hereditary, and it's passed down through families in general. So what tends to happen is you inherit an opportunity to develop diabetes. It's not 100%, but you're more likely to develop diabetes if you have a specific gene that is passed down through your family. So I'm doing my very best not to use big medical terms because I want this to be relatable to as many people as possible. I want people to actually understand what's going on. Diabetes itself is a result of an inability to properly metabolize sugar, within your body. And so what that means is the processes that God has designed to work to use an energy source, which is sugar, doesn't work as well in people with diabetes. And because of that, it results in elevated blood sugars, which can be dangerous for multiple reasons. So we have elevated blood sugars resulting in kidney failure, can result in problems with your vision, can result in problems with blood actually traveling to your extremities, resulting in wounds to your feet that then might result in an amputation. And so again, I'm staying away from those big medical terms because I really want people to understand that these are the long-term results of having elevated blood sugar. Having blood sugar elevated for one day, for 1 week, for 1 month doesn't result in these types of issues. It's the longer term, for years, for decades, that has these types of results. And these are the types of things that we want to avoid. So how do we avoid them? In general, by controlling blood sugar. We keep your blood sugar within the normal range. Normal range for blood sugar is 60 to 100 milligrams per deciliter in the US. It's different calculations in other countries. But here it's 60 to 100 milligrams per deciliter. And that's where we want your blood sugar to stay, in that range. Now, outside of that range, elevated, it becomes a serious issue. And so we use different types of medications to keep your blood sugar within that range. I'm going to stop right there. That's a lot of information already for some people. And I want to hear what questions you have about diabetes medications. I do want to give one disclaimer. This channel is going to be used to give information in general. I'm going to offer generalized information about disease processes, about pharmaceuticals in general, about some naturopathic medicines in general. And what I will not be doing on this channel is diagnosing anyone or prescribing treatments for anyone. Unfortunately, this is not the medium for that. Nothing that I say here in video format can be used as actual medical advice, because I don't know your individual situation. I don't know your history. I don't know what other medications you're on. There's so many unknowns that I'm unable to provide medical advice through this forum. So please understand that what I would like to have is a conversation. This is not individual medical advice. Okay, so please drop your questions. Let's do the general questions. Let's get a general understanding of diabetes, what it is, how it works, how we can continue to live and thrive even with that diagnosis. And hopefully some people will find this helpful and take charge of their health and continue to live a prosperous life. Okay, till next time.